So orthodontics is really a very challenging, but also a very popular and competitive residency program to apply to. So what's been the hardest part for you in this process of applying to ortho residency?
Definitely. So kind of the hardest part, there's so much to balance. I feel like for ortho, there's a lot that they have in terms of like if someone were to say there's a checklist of things that you have to have, the checklist is like miles long of all of the stuff that they expect from applicants. And so with doing that, it's sometimes super hard to be able to prioritize taking care of ourselves because there's just so much. You take the GRE, you have to all of the stuff that you have in personal passions, and then all the extracurriculars that you have for that dental school itself, which is in its own right something that's super difficult to be able to navigate through. And so just being able to like juggle all these things while being able to make sure that you're taking care of yourself and making that a priority as well was definitely one of the more challenging parts of the whole process.
Orthodontics, known as the black box of dentistry, has come upon us again. It's the profession, or actually, it's the specialty within the profession that you don't get a lot of information about as an undergrad. However, you do get a lot more information if you get into residency and you on your way to becoming a board certified orthodontist. Stay tuned as we talk to D4 who just matched in ortho. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into dental residency and specialty, and then life as a new dentist. Guys, be sure that you are continuing to stay tuned and support the channel. I need your help. We need your help. Your colleagues need your help by supporting the channel. There's different ways to do it. Check down below. But we need your support so that we can continue to bring this information to you all, both here in the US and also across the globe. So find ways to share, to subscribe, to join, and support the channel. Also, this episode of Ask Dr. Darwin is being brought to you by, boom, getintodentalresidency.com, right down here. Getintodentalresidency.com, the ultimate resource to help you and navigate the very difficult and complex and challenging application process to become a resident with some advanced dental education and training. Hit the link down below for more information, and we're here to help you get into residency and your dental residency this cycle. All right. So today, guys, we are joined by a familiar face, especially if you've been following the podcast for the last 4 to 5 years. About 4 years ago, we had him on the show as he just got accepted into dental school. And guess what? Time flies. And now it's 4 years later, class of 2023, and he's not only is he getting ready to graduate, but he's also getting ready to get into ortho, become a board certified orthodontist. So today we're joined by student doctors, soon to be official Dr. Isaiah Sampson. What's up, man?
How's it going? It's funny you say that soon to be doctor because
Soon
it
to
seems
be.
like, yeah, when we first started doing it, student doctor, I was like, oh wow, this is super new concept, and now it's like 5 months away from being doctor. That's crazy to think how
Five
time's just
months,
flying
five
by.
months, 5 months. It's flown by, and here we are. So today we're going to be talking about his journey to ortho, how he prepared for the application, the schools and programs that he applied to, and why. He'll also share a little bit more about the interviews, how he put his rank list together, and then most importantly, for a lot of people, some advice for current applicants or future applicants looking to apply to ortho. So a lot of information, guys. Stay all the way through. All the way through. No cheating. All the way through. Stay all the way through so that you can, so Dr. Isaiah can drop the gems and you know where to pick them up and write them down and implement for yourself. So, Doc, some people have not seen our video, which is right here. Check over here. No, check over there. There it is. Check. There's a link to that video right there from 4 years ago. But a lot of people haven't seen it. So please introduce yourself for those that are meeting you for the first time.
Hey, my name is Isaiah Sampson, fourth year at UCLA School of Dentistry. In undergrad, I went to undergrad at Arizona State University, majored in microbiology with a minor in music. I've lived in a lot of places, but home for me is like Tacoma, Washington area. So likely going to end up back there after I'm done with all my residency. And that's the short and sweet, pretty much.
Gotcha, gotcha. So let's dive into it because um, the ortho cycle for this year just somewhat ended. There are some post-match positions that are open. So there are some people that are scrambling around if they haven't already this past week trying to find post-match positions. And we'll talk about that in another episode, how to strategize and land some post-match positions in ortho. But for the most part, you don't need to do that because guess what? You matched. So we're going to talk a little bit about that. So first thing is ortho. Why ortho? And please share the story that well, you and I know, and maybe a couple other people, but it always has not been ortho, but it's ortho now. It's officially completely ortho. So why ortho? Why did you decide to do ortho, man?
Yeah, actually, I came into dental school thinking I wanted to do endo or oral surgery. So that's completely different. Had those like I did some shadowing before dental school, and those are the ones that I came in really interested in. And throughout the first year of dental school, I had gone through everything. And when we took every class for every specialty, it had been like a breath of fresh air. I wanted to do. I was like, oh, pathology is cool. Oh, radiology is cool. Just going with every single thing was piquing my interest. And then kept taking our classes, and we had our craniofacial development class. And that was super interesting learning just about growth and development, just how it works in general, like the physiology behind it. And then in addition, like when pathologies and different types of abnormalities develop, like what that kind of looks like and what are the interventions. So that class really opened my eyes to that aspect of dentistry, which I thought was interesting. But that is applied in a lot of different specialties. And then we went on through education more and took our first ortho class and then kind of learning about how those things relate to those craniofacial development, like growth modification and the different appliances for that. And just all of the ways that I didn't recognize that ortho could impact people, which was super cool. And then going and shadowing and seeing the environment of ortho, how dynamic it is, like all popping around a bunch of different chairs, exchanging energy with a bunch of people. So it seemed like the didactic aspect and the coursework based aspect of ortho was super interesting, and then like the private practice and on day to day basis what that profession looks like. It really merged well together, fit my personality really well. And so from then I was like, okay, straight and narrow. We're gonna figure out how to get into ortho, and so that was how it kind of happened.
Yeah, and it happened intentionally, but unintentionally, and then organically, right?
100%, one hundred
And
percent.
and guys and gals who are listening and watching, just know that that's okay. Like you don't have to decide D1 year, I want to do ortho or I want to do pedo. Like there will be things in the over the course of the first 3 years of dental school that will change and have some input or inputs into your decisions. And it's okay. It is totally okay, right? The fact the main thing is that you've come to a decision that yep, it's ortho. I'm going to be a board certified orthodontist. Yep, you make that decision. That's the most important thing because then you can move towards doing the things that board certified orthodontists do or have had to do to get done to get to that stage. So the main thing is coming to that decision and then moving forward. Um, so you came to that decision a little bit later, not necessarily first year, maybe second year, maybe third year, right? And you decided to make, 100% it's going to be ortho. So that means you got to go to an application and start that. So share a little bit about how you, started to put together your application.
Yeah. So from the beginning of dental school, there's a couple of things that like just within healthcare in general, I'm really interested in, like increasing representation in healthcare and specifically within dentistry, things related to advocacy within an educational environment with representation and of underrepresented groups. And so I was always involved with a lot of stuff related to that. And I think whichever way I went, whether it was to specialize or to not, I would be doing things that were related to those. And so in terms of an application, those aspects of my application were pretty much set from the beginning because this was the stuff that I decided that I wanted to do. That's where I wanted to invest my energy. And then upon deciding that I wanted to do ortho, it was like, yeah, later in the first year, beginning of that second year, being able to see the different things that go into that, like I mean, I don't like to do the whole checklist thing, but it seems like for ortho, it's just so important because there's so many people who have so many brilliant things on their application. You don't want to
Yo,
leave any stones
you
unturned.
gotta
Like
have a
you want to be able to,
checklist.
yeah, yeah, you
Gotta have a
have to have
checklist
everything.
because otherwise you're gonna check out.
Exactly, exactly. This the process is very, very hard. So you don't want to go through the whole thing and not work out. So I was figuring out all the things I needed to do, like getting into a research lab. I got into a research lab like the end of my second year and did research for that third year, figuring out what that GRE is going to look like. And especially because I go to a school that's pass, no pass, we don't have grades. And so the GRE is really the only
Ooh.
numerical metric they have. And so for other students at different schools who have GPAs, it may not matter as much for the GRE. But since I don't have grades, there's a really large emphasis on making sure that we do really well on that. And so
Is there ranking?
figuring
You have any ranking
we
at
don't we don't have
UCLA?
ranking grades,
No,
we don't have
no
anything.
percentile. Like you're in the first percentile or the first quarter percentile or the second. None of that either.
We don't have any of that. We have what's called like honors and individual courses, which is like the top 10% of scores. But with COVID, a lot of the honors were like taken away and they didn't have honors for most of the classes. And so we didn't, it was just a whole bunch of passes. And that's how the transcript looked. So I had to make sure that I did really well in the GRE. Actually, I took it twice. Where like my mentors were really encouraging and being able to recognize that these are some of the things I needed to do. So I took it twice and was really happy with my score that second time. Um, and so, yeah, being able to get that research down, making sure my extracurriculars, whether it be like volunteering or the different types of work within representation of dentistry that I was doing, making sure that I was doing that to be suited to my passions and not necessarily suited to what people think needs to be there for like an orthodontic residency. Um, and then since I was so involved with those sorts of things and not necessarily like ortho study club and like ortho clubs and all that kind of stuff, I didn't have ortho on my on my CV when turning it in, which is not very common. So I had to make sure that I had at least something to articulate my interest in ortho. So doing a bunch of shadowing. I was doing shadowing like once a week for it was for a while.
Now, where was
Um,
that? Did you do it within the school internally or did you do it externally?
I did both. I shadowed a good amount within the school at the resident ortho clinic, and then I also shadowed at private practice to make sure to get exposure to different types of orthodontics, what it looks like in different areas.
Yep.
Um, and be able to see what how it fully encompasses ortho on a practical level. And there's huge philosophy or like principle differences between the different types as well. So it was really cool to be able to see that. But I had to make sure that I had something to articulate how interested and dedicated I was to ortho itself. And so that shadowing was how I did that for sure. And that was pretty much most of what my application entailed.
Yeah, yeah. Well, that's a lot. I mean, and that's another reason why you want to have a checklist, right? So you can
Mhm.
get it out of your head, get it on piece of paper so that you can follow up, but also that you have helps you with a strategic plan to make sure that you have things that you need to do, and then when you do them, you're checking it off so you can get to the next thing. Because as many of you already know, your time is already being monopolized, but monopolized, monop- monopolized by regular dental school stuff, right? You don't have to apply to residency program, so it's not a requirement for graduation. So you have all your other graduation requirements that you have to do. This applying to residency is extra, right? So
Yeah,
you
dental
have to,
school is hard enough.
yeah, dental school is hard enough, right? So, and that's the reason why you're applying to ortho because you got to, you want to become a dentist first, right? So Another reason why you want to make sure that you have the things that you need to do to get done and you're organized and making sure you have a checklist as part of your application as well. Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you, but you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode. So part of the application too is once you put it together, you also got to send your application to programs, but you got to know what programs you want to apply to. So let's talk about that, and as it relates to how you came to formulate your list of programs and the reasons why maybe you picked certain programs and how many programs you applied to.
Yeah. So a lot of people have different philosophies when it comes to selecting like the amount of programs or what are programs. Like some people would like to only apply to the ones that they're extremely interested in, and that's how they go about just maybe applying to, what is it, like 10 programs or so. I've known some people to apply to less than that because they're trying to be very specific in where they want to go. And that's definitely a way to go. I definitely went the like shotgun PCR where I really wanted to make sure that I was getting in. I didn't think I could financially support another cycle. And so I decided to apply to as many schools as I can. I worked my second and third year in dental school so I could be able to have enough money to apply to as many schools as I can. So basically with the main things that I wanted to see in a program, which is being in an academic institution, having a master's associated with it, having some sort of craniofacial experience. And so looking at all of the programs that within reason of location that I found fulfilled those requirements, and I applied to them. So I ended up applying to 33 programs, which is a bunch, to say the least. It is a lot. But I wanted to make sure that I could get in this. I didn't want to have to do this again.
33. Those that are listening, you can't see my face right now, but 33, brother.
Yeah, it's a lot of, it was a lot of money to say the least.
But yeah, again, guys, doesn't mean you have to apply to 33. It is an investment, whether it's 3, 13, 23, or 33. It's still an investment, right? And keep in mind, also, there is no magic formula or number. Because at 100%. The end of the day, all you need is one interview and one match, one acceptance. That's all you need. And you can do that with one program, but not necessarily recommended, but yeah.
Yeah, and there's actually like research that shows without above a certain amount of applications submitted, it doesn't necessarily make too much of a difference in your ability to match or not. But I just wanted to be able to give myself the best chance, regardless of whether it's anecdotal or not, to give myself the best chance I could with that.
Yeah, and that makes sense. Makes sense. But also what makes sense is having some intentionality behind it as far as why are you applying to these programs or certain programs, and you spelled it out. You wanted an strong academic base. Didactically, you wanted to be able to get a master's afterwards and having a little bit more than average or general exposure to craniofacial abnormalities and other malocclusions as well. So again, you guys got to make your list based on what you're looking for. And if you don't know what your list or what programs what you're looking for, that means it sounds like you got to do some more research as to why or what parts of ortho you're really interested in. And that's easy. You just got to continue to dive into the profession, the specialty. Go to AAO, go to the membership organization for orthodontists and search their website and see what things are on there that interest you or could interest you. And that'll help you potentially maybe even put together your list of programs as well. So you had your list together, you applied, um, and then you have to wait, right? It's probably
For
summertime now.
forever.
Yeah, you're waiting summertime, waiting to get an email or get a phone call or a text or what have you, and then you get some invitations. So tell us a little bit about the interviews. Um, Not only about the interview days and the number of programs that you received invitations from, but also uh, the interview as it relates to maybe specific questions that maybe as an ortho candidate that you will only get as an ortho candidate versus a pedo or oral surgery candidate. And tell us a little bit about, how what that day was like, that interview day was like.
For sure. And so in terms of interview invitations, just I applied to 13 programs or 33 programs. And so I was like, I just hope to get two or three. But luckily enough, I was able to receive like 13 invitations. And then I was able to attend like 10 of those interviews. And so I got super, super grateful for how the cycle ended up. And then going forth towards the interviews, I was not sure, there's not any information online about what a lot of ortho things, whether it be like what GRE score to get, how to be competitive, let alone the questions to expect for an interview. And so I didn't necessarily know what to expect. And I was very shocked to see how casual a lot of these interviews were. It seemed like I answered the question like, why ortho? Why this school? Tell me about yourself. I don't know how many times I had to answer that question, even within one day. It seems like multiple interviewers within a
Yep.
day, and all of them would ask very similar questions.
Yep.
And so that there wasn't very many intense situations where I felt like I was being grilled. A lot of them really just wanted to figure out who you were, if you were someone who they would want to just be with on a casual basis, and if you would fit in with their cohort. So it was very, very casual for the most part. There were some interesting, like just random questions. It'd be like they'd give you a quote and they'd be like, "What do you think about this quote?" Which is kind of random. Or they would ask you to like teach them something or like how to
Yep.
do something or about something. Um, there was one question that was really interesting. It was about like it was a scenario talking about insurance and different practitioners like have different philosophies on that, and gave a scenario of like, what do you feel about that? But for the most part, it was very casual, just asking you why ortho, what about yourself? What do you do to take care of yourself? What are your interests outside of orthodontics?
Hmm.
And then also a lot of questions were specifically related to things on your CV. So nothing too crazy, which I was both shocked and glad to be along the road. It wasn't as intense as a interview process as like say dental school was.
Yeah. Well, sound like for this cycle, at least the places that you interviewed at, you were lucky because I have heard stories in the past as in just last cycle, the cycle before this one, where there were some questions about, you know, stuff that's in the profit book that we all have and have been exposed to, just very minimally, but still exposed to. That may be a question that people ask as far as angle classification and you know, what year and what are some of the different backgrounds related to angles classification, Div 1, Div 2, all that kind of stuff. Basic things that, of course,
Yeah,
you
that's
should
tough.
know, things that you should know, even as a dental student, but not as an orthodontist, but things that you should definitely know because you're interested in ortho, right? Uh,
Definitely.
but yeah, so I've heard stories about that as well. So sounds like you got off pretty well. And you're right, for the most part, a lot of programs want to know who you are as an individual, right? This is the first time that they maybe get to meet you face to face if your interviews were in person or even virtual, so that they can put a face and a personality and a character to your name and your application. So, and which is key because they want to know who they are getting as part of the overall culture and the environment in the residency program. Um, but again, even with that short amount of time, you can be on your best, anybody can be on their best behavior for 20, 30 minutes in an interview. So, but
Yeah,
it's still crucial, right? It's still important. So 13
100%.
interviews out of your application pool, and you're able to to do 10 of those. Now, were those, again, those programs, where were they located? Those 10 interviews? Did you have to do a lot of traveling?
Yeah, I was jumping from coast to coast pretty much. I didn't get lucky with being able to stay like say I was in California, go to another California program. It was going from it was from Pacific time zone to East time zone
Oh
repeatedly
my God.
for like a month. It was just jumping back and forth.
Yeah.
And so the traveling was really interesting, having to be on a Pacific time zone one day, then East time zone the next day, and then back on Pacific the next day, and then back on East the next day. And so it was very interesting. But I was grateful nonetheless to be able to have that burden
Yeah.
to have to jump time zones.
Yeah.
But most of them were in like West Coast programs. It was like split in half pretty much. West Coast programs, one program in Texas, and then other programs were like either Midwest or on the East. But that was mainly where I pretty much applied in the first place.
So that's good to know because I know a lot of people, always want to get an idea as to programs people are applying to and why. And in a minute, you're going to share with us, I'm going to reveal where you matched that. But can you give us an idea of those 10 interviews, where they were? What programs were they?
It was like the Arizona School of Dental and Oral Health,
Mhm.
then University of Washington, UCLA, Michigan, UCSF, um, Oregon, uh, Maryland, Texas, San Antonio,
Yep.
Columbia, VCU. Yeah, those are the ones I went to, and then I didn't attend Case Western, Minnesota, and Illinois, Chicago.
UIC. Yep. Gotcha. Gotcha. So yeah, you're right. You guys heard the list. It's all over the place. West Coast, Mid Coast, or mid well, no coast, and then East Coast. So amazing, man. And that's again, congratulations on getting those invitations. So you get the invitations, you go to the interviews, and in your case, man, you got a full-time job now because now you got to rank your program. And you got
Yeah,
probably, you have to make a decision on all 10 of these. And typically what happens is, after your interview, some of the ones that were your number two or three or fourth choice or ranked, maybe that has changed after the interviews, right? Because
$100%.
this is your time to really investigate the programs because you got to choose the programs too, just like they have to choose you. So, and that's why it's so important, and we talk about it in our training that we do with your interview process of how to make sure that you're getting the most out of the application process related to your job as a candidate, which is you're interviewing the programs too to gather your information so that you can make your final decision related to what programs and most importantly having to rank several programs. So tell us a little bit about how you went about ranking the programs and again and maybe tie back into the reasons that you selected certain programs, but just share with how you went about formulating that rank list because that also can be a challenge for many people, especially if you have a multitude of programs that you've interviewed at.
Yeah, it was very challenging, and especially like referencing what you were saying, I would leave some interviews feeling completely different about a program than I went into it. And so if I would have shown my like what past self the rank list, I wouldn't have thought. I would be like, "Why? There's no way you ranked it that way. That doesn't make any sense." Because I had certain ideas of how programs would be, and then certain ones it just comes out completely different. And so again, like to what you said, it was thinking about the different things of why I applied to them in the first place. So like how stringent or rigorous is their didactics? Because especially being in my pre-doc program, we have very, very rigorous didactics, and I loved how that shaped me into the provider that I am right now. And so being able to continue that within the specialty was something I found important. Also, like how much craniofacial experience some have like seminars, and you have a rotation of craniofacial orthodontics, and some you're on like weekly. You have patients of your own who are have these craniofacial abnormalities that you're treating on a regular basis, and so being able to know which programs have a lot of exposure for that, and then just like what is the reputation of the program in terms of how much clinical exposure they get and what the magnitude of that clinical exposure looks like. And so being able to get a feel of that, talking to the residents at the interviews, and a lot of the programs will give you numbers about how many cases they see, what types of cases, what is the breakdown and percentages of each type of the treatments that they have for their patients. And so all of that going into one, along with the cost associated with the programs, was something that I put together. And it was lucky enough that like it was like half and half. Half of the programs were around the same price, and then the other half of the programs were around like the same price of a different bracket. So it came down to those things essentially. It was the cost went down the list, and then all of those other intangible aspects of it that went into it, and then overall how I felt energetically about the programs, like emotionally, how do I feel like I would be there. And so it was like this weird way of going about it. I had like a weighted point-based system where I had all of the different characteristics of what I would want out of a program. I rated that in terms of importance, and then used that to weight each of the like what I thought each program had. So I rated the program, like how much they fulfilled that, and then used that and plugged it into how much it was weighted in my importance, and then use that and also to give me sort of a metric to know more so objectively where I stood on the programs, to be able to support how I emotionally felt about them.
Yeah, and so people, people hear now that it's not a hard process, but it's not an easy process, and it has to be intentional, right? Because this is where you're going to be for 2 or 3 years, and you want to be able to make the best decision for yourself based on all those factors that you mentioned, but most importantly, your mental health and emotionally, and how you feel about the program, because you will be there for, you know, almost 1,200 days if it's a 3-year program. That's your home. That's your spot. So you want to make sure that it's uh, an environment that's conducive to your educational, but also your emotional well-being. So a lot of things to go into about selecting and ranking programs. All right, so we rank the programs and it's match day. So share with us. We're gonna reveal. Where's my music? I got some. You guys are fine. Where's the music people today? They not here.
The band took the day off.
Yeah, let me push my own music then. We'll have a little drum roll here. So where will you be taking your talents, your soon to be ortho talents to?
So open up the email on match day, wondering how it's gonna go, and I was lucky enough to know that I was gonna be I'm gonna be attending University of Michigan.
Michigan, yeah, there you go. There you go. Not on the coast. It's a no coast state. Or no, it does have a little coast up there where Canada is and everything. But it's not West Coast, not East Coast. It's in the middle. It's the middle coast. So congratulations, man, Michigan. Yeah, I've heard some good things about Michigan, but I also hear that program director is no joke.
That was one of the things that it was like it was a kind of a push pull. I heard it's very, very rigorous, and so I was like, oh, like the part of my personality is like, oh, I need to challenge myself, and this is like my final step in education, so I want to. But then part of me was also scared. I was like, how much more of this can I put up with?
Right.
Because dental school enough like alone took so much out of me. But
yeah,
coming down to it, knowing how rigorous that program is, and how rigorous like the reputation of in terms of how difficult and how much you get out of it. It was hard to not want to go to that program, seeing how confident the residents felt, and just the reputation and the history of the program. In addition to that, I'm going to be in the centennial cohort, the hundredth class for that program. So there's a really long history for
no pressure.
Yeah, 100%.
Just 100 years of cohort. Yeah, that's all. That's all.
Yeah, so
well, that's
that
great
was something
news,
I really
man.
liked.
That's awesome. Yeah, I had heard that it was no joke, and that was not from an Michigan ortho resident. That was from a dental student at Michigan who graduated from Michigan,
Yeah.
who's he's not an orthodontist, but he was like, "Yo, that program, that program director is no joke." But hey, it's an investment, and you'll be fine, man. You want them, they want you. Perfect match, and congratulations on that as well, because that's key. That's key. Going to a place where you want to be, that's going to challenge you, but also prepare you for the now and the future, right? The now and the future.
100%.
So we've got some future applicants that are watching and listening right now, and they need some tips. They need some advice. Knowing what you know now, as an applicant and now soon to be ortho resident, share with us some things that you maybe not do differently, but definitely some advice in how to navigate this process.
Something that has been like almost incalculably contributing to like how positive this experience has been like how great of mentors I was able to get. So these are whether it's orthodontists who have recently graduated or current residents. I was very proactive in being able to get some sort of direction from people. And there's a few specific like residents who played a ginormous role in informing me about what it takes to get into orthodontics, like the nuances of the application, the nuances of the interviews, and what to look for in programs, and having their experience and like the people they know being able to inform from a lot more of a I can be a lot more informed with it because there's not a lot on the internet to be able to help learn about what the process is like, what the programs are like, and all of that kind of stuff. And so, one thing that I would wish I would have done like was to get mentors earlier, to be able to gather more and more information. And so it was great to be able to have mentors. I wish I would have done it a little bit earlier. I don't think that it was bad, the timing that I had, but it's always great to be able to get more guidance and more direction earlier on to prepare yourself better. Because some people will be like the summer before the application decide that they want to do something. And at that point, it's kind of tough to be able to build an application a certain way. So being able to get that mentorship and that guidance earlier to know what you need to have on that application and what you should build yourself to be as a healthcare provider is something that I definitely am a proponent for.
Any other tips? Any other pieces of advice related to mentorship and things that people can do as they navigate the process?
And it's really hard to be able to figure out how. I'm a big social media person. I love social media. And so I was always reaching out to residents on social media. And so this took the form of some ways are easy. You can just type in ortho, and some people will have like orthodontic resident in their name. And so it'll pop up some orthodontic residents. And then sometimes different programs have Instagram pages. And so also being able to see who the residents are on those ortho Instagram pages is a cool way. And then also like LinkedIn and different ways like that. There's a lot of different avenues to be able to connect to people, and those are the ways that I found the most fruitful for sure. But I'm a big Instagram guy, so it was a lot of Instagram for sure.
Yeah, and I think the same goes for that momentum for residency programs and being on social media is definitely a spinoff of how active a lot of dental schools are on social media, right? More specifically, certain organizations, student-run membership organizations at dental schools. Everyone has their own page, and they're sharing information, whether it's membership drive, notification to members about an upcoming webinar or presentation, to community service, right? To be able to participate in community service. So that's definitely a way to network and connect with people using social media, because that's key. That's going to be key to helping you apply and gather the information and preparing for interviews, following up, and just getting more of an overview of the programs that you're considering as part of your application. What's the best way for people to get in contact with you if they have some more questions or want to talk to you some more?
Probably the easiest and the quickest way is I'm always on Instagram. Dr. Darwin probably put the name at the bottom, but it's IzzySamp, IZZYSAMP. So always on Instagram, that's a very easy way, or my email, which is isaiahrsampson@gmail.com. So those are the two ways that is very easy to be able to find me.
That sounds good. Well, finding you 4 years later has been a blessing, because not only you get ready to graduate, but you're also getting ready to go and become a board certified orthodontist. We're proud, happy to hear about this newest accomplishment. Wish you continued success. And guys, check out these videos. These will help in your journey to success and becoming an orthodontist and also applying to residency. And that's our time. Love, peace.
Binge those videos.
And smile. That's right. Go to the next video. Thank you. Go to the next video right now. Go, 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 go.
Next assignment is go to the next video. Go to the next video right now. Go, go, go. Love, peace, and smiles. Go to the next video. Go to the next video.